Hello and welcome to another segment of Interviews That Matter. I'm our host Raj Mehta. Friends, in this segment we bring those guests who help our community. This includes elected officials, policymakers, heads of major organizations and other dignitaries. It is my sincere hope that the knowledge brought in by this guest will help our community. Today we have such guest. His name is Dr. Sanjay Goyal. Dr. Goyal is by profession is a doctor, physician. He is also an entrepreneur, and he does a lot of charity work. Mostly we will be talking about his practice in diabetes and also his charity work. Dr. Goyal, welcome to the show. Appreciate your time very much. And what we normally do is we start with the introduction of the guest. So I would like to hear from you that what is your background, how did you come here, when did you come here, and just give us the whole life story.
Thank you, Raj, for inviting me to this show and the opportunity to express myself and my organization. My name is Sanjay Goyal. I'm a physician, endocrinologist by profession, based in New York. I graduated from SMS Medical College in Jaipur and came to this country in 1987. Took my ECFMG exams, residency and fellowship, and started my practices in 1995. And I'm based in Long Island. And since then I'm in private practice, affiliated with few hospitals in Long Island, currently with Mercy Medical Center.
So tell me, you said you're a physician, right?
Yes.
So what is your practice like? Basically you see patients and
my practice is private practice, so I have an office in Baldwin, New York, and I have patients. I do only endocrinologists, so patients are only coming with appointments only. I'm affiliated with Mercy Hospital, and I see consultations for inpatients in the hospital, and that is my basic routine.
So you graduated in Jaipur,
yes,
right? And then what prompted you to come here?
Like everybody else, America is a land of dreams, and my uncle was here initially, and then he got us green cards, and I came to this country looking for more opportunities and future.
So, but your background in India also, like you come from a very, well-to-do family.
Yes, yeah.
Right? So you could have done good anyway.
True.
Right? So why I'm asking you all these questions is, why I'm asking you this is that because, see, you already were well off there and you could have done better here. But then, like, for example, when I came into this country, right, I wanted to do something on my own. That was the whole, my thing was that, I could have also done a lot of different things over there. But I came because, I wanted to be on my own, and do everything on my own. So, is that something that you had in your mind?
I think the opportunities are better, education system is better, and I was able to get my residency of my choice and fellowship of my choice here. And, my family was here, so it was good to come.
Your family was here already?
Yes, yeah. My uncle, my brothers were here.
Oh, your brothers were already here
yes,
before
yeah,
you?
Yeah.
Oh, okay. So so that also prompted basically,
yes,
right?
Yeah.
That everybody's here.
Yes, yeah.
So you thought that you want to come here too, right?
Yes.
So you chose medicine, obviously, from India.
Yes, yeah.
Right? And obviously, that was your heart in medicine, or somebody like you followed somebody.
When I was, I think, if I remember what prompted me to go into medicine,
Right.
One of my cousin sister's husband was a physician, and he was posted in a village. And once I was, I think, maybe 8 or 9 years old or 10 years old, and I went to that village. And when I saw him walking around in the village and people respecting him, and this community service he was doing and the respect he was getting, that really prompted me to go into medicine. I just wanted to be a physician and be able to do a lot of things for community and help people and get respect. Yeah.
So that's how you got kind of, in your heart that, you also want to be a physician,
The
or
physician,
a doctor
yes.
rather.
Yes, yeah.
When you grow up, and then you kind of achieved your goal basically.
With the help of, yes.
Right?
Yeah.
Right.
Yeah.
So did anything else, like, for example, anyone else wanted you to go to engineering or something else, and you still stuck on being a doctor?
No,
or everybody was supportive?
Supportive, very supportive. I had physicians in my family. My uncle was there. My
Okay.
cousin brother was a physician. The husband of my cousin sister was a physician. So there were physicians. They were doing a lot of services and things. So, and my father was an engineer, so he was an educated person. So we had a lot of education in our family. And my brother was an older brother, went into engineering. I went into medicine.
Okay.
Yeah.
So that's good. At least, everybody was supportive of you, what you want to do, and
Yeah.
basically, so the service part, serving the community was from the beginning actually in you. That
Yes,
you
yes,
really, was
right.
that a respect or service?
It's both. I think when I saw, if you see anybody else getting respect out of fear from people or because you're prosperous and people respecting you, but this was a pure respect from their heart because he was doing only service to them. It was a government job and it's not very well paid in those days. But and those villages were very primitive villages that I'm talking about. There was no even electricity there.
Wow.
So living there and doing these services really a big admiration. And if you look at being educated in major cities and then you going back to these villages
Right.
and be able to live there, it's really admirable.
So you were 8, right, at that time when you went?
I think
first
8
time?
or 10 years
8 or 10,
old.
whatever.
Yes, yeah.
But you were very young at that time.
Yes,
So
yeah.
did your cousin ask you to go, or you went yourself? I mean, because
To the village?
yeah, to the village, because
You
8
know,
to 10
in
years
the-
old. I mean, you just want to enjoy it.
Yes, in summer vacation,
Oh,
you
in summer.
basically go to uncle's house, grandparents' houses.
Right.
So we went to, me and my cousin also went to this village and just to spend summer vacations.
So that was the one time, or you went then every time?
No, it was one time visit to that village, and then he was posted to different villages also. They were, yeah.
Wow. Okay. So obviously, like that's how you kind of become more passionate to become a
Yes,
doctor. And I know, what I'm telling you honestly, that I'm also many times jealous of you guys, because you can help anybody, anywhere, anytime, and that you can do that. And I've
Yeah.
seen myself, many times, when I'm going in a plane and, there's somebody has any issues and I cannot do anything. Whereas
Yeah.
you, as a doctor, can help immediately somebody.
If we can.
Well,
Yeah,
I mean, at
in
least,
some
stabilize the
situations.
person or
Yes,
whatever,
yeah.
like I've seen it, with my trips, that, doctors have helped them immediately, right? So at least, you can stabilize the person until the plane lands or whatever. But the bottom line is you can help anybody, anywhere, anytime. Whereas person from my profession, we cannot do that. So I'm always feel a little different. I mean, I wouldn't, everybody does their own thing, obviously.
There are different ways to help
Yeah.
people also, it's
Right.
not just a medical profession, armies, police, ambulance people, nurses, then you have financial support is always required for all these services also. Yeah.
So are you, you said you are affiliated with some of the hospitals here, Mercy Hospital?
Yes, yeah.
So basically you send, patients over there and something like that.
When patients are admitted to the hospital for any reason, and if they have any endocrine issues, mainly diabetes issues, out of control diabetes, then I do consultations and help the primary care physician to, stabilize patients from my point of view, diabetes point of view.
So when you say diabetes, right, that's what your focus is? I mean, you help more diabetic patients, or?
Endocrinology is, bread and butter is basically diabetes. If I'm seeing in my practice, I think 90% of my practice or 85% of my practice is diabetes.
Okay.
And then other disorders like thyroid and other hormonal issues come into play. But main thing is diabetes.
So obviously, I mean, we all know what is diabetes, right? It's a sugar level, basically. So do you want to like explain a little bit more in deeper to the giving knowledge to the viewers that how do they know they are diabetic, or what are the symptoms, and how do they prevent it from happening? Anything that you can talk about diabetes.
Diabetes is a very common disease now, but a lot of people are being affected, and then there are risk factors for development of diabetes. When we are talking about diabetes, most of the patients with diabetes, 90% plus population of diabetic patients is type 2 diabetes, and very few are type 1. So type 2 diabetes, there are risk factors for development of type 2 diabetes. One is family history, then sedentary lifestyle, obesity, some genetic predisposition also, and then more processed food, lack of exercise. These are the risk factors. So if somebody has a family history of diabetes or obesity, or any symptoms indicating diabetes, like increased thirst or increased frequency of urination, unexplained weight loss, tiredness, then they should be checked by their physician to make sure they don't have diabetes.
You said type 1, type 2. What is the type 1 and what is type 2?
Type 1 diabetes is, broadly speaking, is when you're a child and you develop a diabetes, right? So those patients basically don't have any insulin production in their body, and from day one they needs to be treated with insulin only.
Oh.
In type 2 diabetes, patients get insulin resistance first. So insulin resistance means your body requires more insulin. So initially you can be treated with oral medications, and now we have a lot of medications that are insulin sensitizing medications that can lower your demand for insulin in the body and workload on pancreas. But eventually it's a progressive disease, so most patient, or we can say almost all type 2 diabetes patients at some point in their life will need to be on insulin from outside if their own insulin production is not enough.
So type 2 diabetes, right? You mentioned some of the symptoms.
Right.
Now, obviously, we have seen, obviously we are all, human body is very complex and very complicated,
Very
right?
much,
Obviously.
yes, yeah.
So some of the people who are obese, still they don't have anything. They are still fine. There's zero, sugar level is very, so mostly like, when you go for a blood test rather,
Yeah.
that's when the blood tells you whether you have a sugar level or what kind of.
Yeah, routine blood test includes glucose level, and if you're checking fasting or postprandially, you can see what your glucose levels are, and that if it is going high, then you can do further testings like hemoglobin A1C or fasting insulin levels to see the predisposition for diabetes.
So glucose level is what is normal?
Normal fasting glucose is between 70 to 100.
Okay.
And in a person who will never become diabetic or not diabetic, it never goes above 140, no matter what you ate or drink.
Okay.
Right? Okay. And within 2 hours, it should come below 100.
Okay.
Right?
Okay.
So there are parameters. If your fasting sugar is high or postprandially your sugar is going, when you will develop diabetes, first thing you will see is after eating your sugar will go higher than normal range, and then subsequently fasting sugars will also start to rise.
So 100, right? You said 140. Now, if somebody has 110,
fasting, that's abnormal. It's not defined as diabetes. Diabetes definition.
Not defined.
Yeah, diabetes definition is if fasting sugar is more than 126, or any random glucose after eating is more than 200, or now the new criteria is if the hemoglobin A1C, which is a blood test that tells us about your average sugar for last 2-month period, and if that number is about 0.6% higher, 0.6 points higher than the upper limit of normal range, then it is also defined as diabetes.
So
if your fasting sugar is 110, coming back to your question,
right,
it's not defined as diabetes, but it is called as impaired fasting glucose. and we can say it's like a pre-diabetes phase where patients are going to be developing diabetes because it's not normal.
So that is what, over a period of time, I guess.
Yes, yeah. Average time that a person will take to develop full-blown diabetes is about 8 to 10 years.
8 to 10 years.
Yes.
So from somebody has 100 glucose level, right? Now it will take them, generally speaking, 8 to 10 years. Generally speaking.
Even 100 is not like normal. 70 to 100 is a normal range. So it's upper limit of normal, right?
Okay.
So the first phase, as I was telling you, is insulin resistance. So with insulin resistance, your body requires more insulin. So initially your pancreas is healthy and it will start to give you more insulin to keep your demand, and your sugars will remain normal. So just think like that, how long pancreas can keep doing overtime, right? So it will start to fail.
Okay.
So over a period of 2, 3, 4, 5 years, it will start to fail and your insulin production will go down and sugar will start to rise, and then you will be diagnosed with diabetes. So we know that by the time somebody is diagnosed with diabetes, approximately 70 to 80% of pancreatic function is lost.
Oh, okay.
Yeah.
Okay. So basically, pancreatic function, producing sugar, is kind
producing insulin.
Producing insulin.
Insulin that controls the sugar.
That controls the sugar.
Yes.
Okay, in the blood.
In the blood.
Right. Yeah. Now you mentioned A1C, right? A1C level. It's a 2-month average. You said, right?
Right.
But when, I'm asking you a naive question.
Sure.
I'm not.
No.
I'm not a doctor and I'm not familiar with all these, things. So
yes.
Sorry about that.
No. Please.
But like for example, if they take blood, somebody's blood, right, for the test, blood testing, how do you go back 2 months?
Basically, in our blood, there are red cells. We call them RBCs.
Okay.
Like deficiencies of RBC can lead to anemia, right?
Okay.
So RBC's half-life is about 120 days.
Okay.
So each day or each minute, we have RBCs being destroyed and RBCs being produced.
Okay.
Right? And there are about 5.6 million cells in 100 ml of blood. So when those RBCs are being manufactured in our body, there's a certain amount of glucose that goes into the cell. And that glucose amount depends on what is your blood glucose value at that time. So you can say every second when new RBCs are being produced, a certain amount of glucose is going in there, right? So if you look at the half-life of RBCs, the total lifespan is 120. So at 60 days, you have new RBCs, which are half of your population, and older RBCs. So if you average their blood glucose that is inside the cells, that will tell you how much was being incorporated every second over last 6 months after 60 days period, and that will give you your average blood glucose of last 60-day period
from the same blood.
Just one egg blood test. Yeah,
from same blood you can figure that out,
right?
Obviously. Wow.
Yes.
Okay. Yeah. And that should be what, about 5.6 or something?
Normal, different labs have different range, but most labs have 5.7 as upper limit of normal.
Upper limit?
Yeah.
Okay. And if it is above that, then obviously...
Then it's abnormal, and above 6.5, you will call them to be diabetic.
Then the diabetic, right? Yeah. So whenever, whenever there's somebody who is, pre-diabetic, from pre-diabetic you become diabetic.
Right.
And diabetic, then obviously, some, like I've seen some of the people, they take insulin injection every day.
Right.
So when that condition happens?
It's basically advancing, it's a progressive disease. So as I told you, about 70-80% of pancreatic function is lost by the time of diagnosis. And then in future, you're slowly losing your pancreas.
Right.
So if your pancreatic function has gone down to a level where you're not able to produce enough insulin, then you will require insulin from outside.
Okay, so that means, it's artificial insulins that you inject in your body, and that will control the amount of sugar level, right? Something like that.
Yeah.
See, I know how it is. Now I can be a doctor. No, I'm just kidding. No. But it is, like diabetic, diabetes obviously is a major disease, and
Right.
and that kind of affects a lot of other things in our body, right? I mean, cholesterol is one thing, but diabetic patient, if that has more risk, I would
Right.
say, in terms
I
of
will say that
yeah.
uncontrolled diabetes in America is, I think, one of the major or strongest risk factor for development of heart attack, strokes, people having kidney failure, going on dialysis, even lower limb amputation is highest risk is type 2 diabetes after accidental amputations, and blindness.
blindness.
All over world, glaucoma is still number one cause of blindness, but in United States, diabetes is number one cause for blindness.
Wow. Is it because we take more sugar, or is our body producing the sugar?
No, it's not just intake of sugar that you're talking about. It is basically whatever triggered your pancreas to start fail and your body to have insulin resistance.
So is this a myth that if I am eating more sugar or sweet thing,
That you
that
will develop
I will get a diabetes?
Not really, no. But once you have diabetes, you want to watch your diet and cut down the glucose intake and sugar intake, basically.
So again, I'm asking you: is this so the more sweet you eat, you may have more chance of getting diabetic, or it's not true?
Not really, but if you have predisposition for development of diabetes and you're not watching your diet, then your chances will be higher, right? So you were asking me what you can do to prevent, and then I will say only thing is, if you have high risk for development of diabetes, watching your diet from the beginning, exercising, keeping your weight in check, and physical activities, those are the things that will decrease the risk of development or delay the development of diabetes.
Oh, okay. Yeah. So pancreatic function, like for example, because the pancreatic creates insulin, and that is kind of leveling the sugar in your body, right? So that means when you eat more sugar, obviously that has to be diluted somehow, and that means pancreatic digested. That means pancreatic have to produce more insulin,
right?
And that means that pancreatic has to work overtime or something like that.
Overtime, yes.
Right, something like that, and then.
But in type 2 diabetes, it is the insulin resistance in the body that leads to increased requirement of insulin, not just glucose intake. Right. So all patients with type 2 diabetes, we can say, have insulin resistance. Insulin resistance means insulin is not working in their body as good as it is working in your body or my body, right? And so those people will require higher amount of insulin to do the same job.
Oh, okay.
Right? So that is why they need more insulin. And pancreas has to overwork to make more insulin to keep their sugars down if it can.
This is very interesting. One of my friend, he is a physician, doctor, he's an internist, right? So he had a very, he made a statement, and I don't, he's a internist, he's an internal medicine, right? A physician, basically. But he made a statement, I'm going to ask you this, since you are an expert in this field. What he said is that whatever you eat, like for example, anything that you eat that has, baked sugar or cooked sugar, then it's fine. It does not, have a problem of as you eat, like other kind of sugar. Like for example, our sweets, like when you eat rasgulla or something, or gulab jamun, whatever. If you, don't eat the, the juice and eat only this, then you're less prone to be, having more sugar or something.
Yeah, sugar is basically.
So you're laughing. That means it's not true.
No, sugar is basically in the juice. Rasgulla itself is basically made of paneer.
Right.
So if you squeeze out completely, it will not taste as good, but yes, it will be better than having a lot of juice with it. Yeah.
Okay, but it's not like you're not going to get. I mean, it's still a sugar.
It's still a sugar. Basically, sugar is, when we say sugar, it's a loose term. Sugar, that we eat sugar, is a very simple carbohydrate, right?
Okay.
But everything, basically, whatever you eat in your body, it has to be eventually converted into sugar to get metabolized, right? So even if you're eating fat or protein or complex carbohydrates, eventually they are digested or processed into sugar.
Okay.
Because certain organs, particularly brain, can only utilize glucose for its metabolism, right, for its survival. So everything is in the body is converted. So when we eat a meal which is mixed with carbohydrate, fat, and protein, these are the only three ingredients of a meal, basically, right? In scientific terms. So carbohydrate can be sugar, can be plant-based carbohydrates, which are complex carbohydrates, right? Fibers and all those are carbohydrates, protein and fat. So when you eat a meal, we are in absorption phase and then absorptive phase, right? So in absorption phase, when we are eating a meal, our body starts to utilize the simple carbohydrates initially, and then the protein and fat sources are stored in protein and fat storage sites, right? When you go into a post-absorption phase, that extra carbohydrate that we eating now is stored in liver as glycogen. And then in post-absorptive phase, the glycogen is being utilized for our energy currently. So that glycogen is converted in glucose. It's called glycogenolysis in liver. So it is converted into sugar or glucose, and then that is sugar basically, and it is being utilized for our metabolism and energy. Once those, in 2-3 hours, once those sources are depleted, then liver starts to use protein and fat and make glucose out of that, and it's a process called gluconeogenesis.
Okay.
Right. So everything is eventually converted in sugar in our body. How much sugar should be produced by liver depends on our need, and then it is also controlled by insulin and another hormone called glucagon. Right. So in diabetes patient, there is also increased amount of glucagon, which also makes them release more glucose, while their sugars are already high, but the liver makes more glucose as compared to a non-diabetic individual, making their blood sugars higher.
So first body take carbohydrate, and then first it uses that and kind of
for
makes
the
it
metabolism and energy requirement for the
then protein and fat.
Right. So that starts to break down in fasting state, approximately 3 to 4 hours after your meal.
Oh, is that right?
Right.
So up to that it's stored somewhere.
The glycogen is stored, depending on the meal also, how big is the meal and how much carbohydrate you're eating and how much protein and fat you're eating. But that glycogen storage can last from 2 to 4 hours.
Oh, wow. So that's why when I'm having a meal or dinner, after that my stomach is big. But it takes about 2-3 hours first before it even
the glycogen depletion,
right?
Yes.
Right.
Yeah.
And so the brain and anything other body parts are using both type of sugar.
Only the glucose is ultimate.
Glucose is
the
ultimate.
Metabolic product of our digestion.
Oh, okay. And glucose is the one that's used by brain and anything like, for example. Right. To function basically. Anything, right? Yeah.
So when patients with diabetes, if they are overdosed on any medication or for any reason, if they have low blood sugar levels, the symptoms of low sugar levels initially come from brain, because brain is the first organ that will see the deficiency.
Oh, okay. Okay. Yeah. In our community also, there's diabetes is very common, I guess.
In all ethnic communities that are coming to United States, basically like Indians, Spanish population, blacks, as compared to their population in native country, the incidence or the prevalence of diabetes is higher.
Very interesting, because
yes,
it's good knowledge that you're giving us.
It's basically coming to a prosperous life basically, and your more sedentary lifestyle here and more processed food that you're eating leads to risk.
So nowadays, processed food has become a kind of
everywhere,
standard life in our life, which is not when I was growing up. Obviously, when I was growing up, everything was fresh.
Organic and fresh.
Fresh actually. right? So now
Yes.
everything is in packets,
Everything.
unfortunately.
And I think the vegetables and all these things with these GMOs, you can see the size of all these vegetables increasing, and
Is it good or bad?
I don't know politically what to say, but in a way you can say, because you need more produce from your land
Right.
to feed this world's population.
Right, right.
So in that way it is good, because you're getting more yield out of your farmlands and able to feed more people. But health-wise, they are not good.
Health-wise, they are not good,
Yeah.
right? So basically, society is becoming
Part of
towards
it, yes.
that way,
Yes.
basically, right?
Yeah.
Because nowadays, especially
Everything, yes.
mostly young people, obviously, they are like
Yes.
more ready-made foods and all.
Ready-made food, fast
right?
foods, and
it's
yes.
not, it's
And then the lifestyle becoming more and more sedentary.
right, yeah,
Yeah.
because of internet and computers.
Computers
and all
and the more outside activities or
Outside
physical
activities,
activities. Yeah.
gone down tremendously. Wow, yeah, not good. So let's talk about your charity work. Like you've been doing it for a long time, and we already learned a lot about diabetes and
Yes.
disease and how to control and kind of what are the symptoms and everything. So you gave us a very good insight in diabetes. So obviously for me, I'm definitely going to be more careful based on what you just said. Not
That's
that
the-
I have a problem now,
Yes.
but but I'll be more careful anyway, right? So let's talk about OM Foundation that you have, right? Tell us about the activities of the OM Foundation.
Home Foundation I started in 2012.
Okay.
Basically, initially I wanted to do something for community. That's what made me to become a physician, and I tried to do some few things here also in New York, like Catholic Health System has free clinics for poor people. It's called Rota Care, and I was part of it in the beginning, and then I was seeing some patients for charity for those clinics for diabetes, but that was not enough for me. Then I wanted to do something else, and in 2010 April, I took first trip to Guatemala, and I saw some patients there, and when I saw those poverty there and people with huge lack of knowledge, without knowing that they were diabetic, and they couldn't afford any medications. So I started going there, and I've been there since 2010 April to now. I've been there 26 times.
Wow.
And each time when I go there, I see about 400 to 500 patients in rural areas of Guatemala, and give them free medications and treat them for diabetes and hypertension.
Tell us about why Guatemala. Why did you choose that?
That's a long story, but when I was in private practice, and my secretary at that time, Nancy Hernandez, she was from a village in Guatemala called St. Louis.
Okay.
So one time her husband's uncle came to United States, and when she brought him to my clinic, I saw him, and he was losing weight, and he was very symptomatic for diabetes, and very sick looking person. When I did his blood test, we found his blood sugar levels were more than 500.
Wow.
And he didn't know that he had diabetes.
Oh.
So I started treating him with insulin, and he stayed here for about 4 or 5 months, regained his weight, started feeling better, and when he went back to Guatemala, we gave him some insulin to take with him, a glucometer to check and monitor his sugars. And when he went back, he must have tested his family members or people in village, and he found about 15-20 more people to be diabetic, out of control, and they didn't know that they were diabetic. So then they started asking me to come there, maybe do something for those people, maybe bring some medications, and they said, we'll support you in any way you want. So my first trip was in April, as I said, of 2010, and it was I will say, very tiring but wonderful trip as far as my insight, I can say,
Satisfaction.
because satisfaction, because when I went there, I was hoping to see it was a short trip. It was a 4-day trip, and the flight was like 6 o'clock in the morning, so I didn't sleep the night before, and reached there, and then it was about 6 to 7 hours or 8 hours drive to the local village. So by the time I reached there, it was already 11 o'clock at night. And then next morning when I went to this place, they had a makeshift clinic. It was just a tin shed and open field basically, and it was very hot, like 90 plus degrees there, and I was hoping to see about 35 patients there, and when I went there was more than 200 people.
Wow.
It was a huge, right? And I didn't know what to do. I had few medications with me. I had taken metformin and some insulins with me and some glucometers, and I didn't know what to do. And half of them, or a lot of them didn't know if they had diabetes, or they just came to see a physician basically, because there was not too many medical facilities in the villages. So then we had to get some nurses from a local nursing school, and I first had to train them how to check their sugars, check the blood pressures, and if somebody needs insulin, how to train patient to take insulin. And then we set up everybody in a line and then started checking their sugars, and half of them I think had no diabetes, but I found, at least in my first visit, at least 50 to 60 patients with more than 400 or 500 sugars.
Wow.
And they did not know. And then just became a routine. I just got into this cycle of going back and back and back, and then so many stories that if you have time, I can share with you, or afterwards I can share with you
about
the
challenges that you had. You already mentioned the challenge from the first trip, right?
Right.
So obviously, it's not an easy task, for somebody who is, having a good meal every day, can have a good meal every day, and can sleep well, and has no problem anywhere in life or outside of, with family and all that. Still gets up and goes over there to do this. I mean, that requires a lot of guts. So I congratulate you on that guts. Really. You have really, like you said, you proved it when you were 8-10 years old, and whatever you saw in the village, you kind of proved it, right? You did it yourself. So what is the biggest challenge? Like, I know that managing people is the biggest challenge, right? I mean, putting it in line and all, and a language is another thing also.
Language I started to learn slowly over last 10 years. I've learned enough Spanish to communicate with the people there. But bigger challenges are, first of all, as you said, to go, to take time off from my practice,
right,
which is a big challenge, because if I go there for 8 days or 7 days trip, then I have to shut down my practice here.
Right.
The second challenge is collecting the medications to take with me, because medications over there are very expensive.
Oh, okay.
And even oral medications are very expensive in Guatemala. And insulin is basically out of reach for, I think, almost 100% population in rural areas. So that is big challenge. Then taking them is another challenge, because whenever I'm going nowadays, I carry approximately 300 pounds of luggage with me with these medications.
Wow. Yeah.
The bigger challenge reaching there, once I reach there, the local people have to make sure that it is okay with the government, the social service department and Department of Health, to clear me for taking these medications without any objection, and not to pay custom duty, because they are for charity.
Right.
And that is a big challenge. I have made 26 trips, and except for 2 or 3 trips out of these, which was a smooth ride, most of the time it's a very hard time to get those medications out of the airport. Really? And last 2-3 times I had to just leave the medications there, because they did not clear it, and then it took a long time for them to clear the medication, and meanwhile I have these patients waiting. So these are the biggest challenges. Over there, it's now I'm used to it. I have a lot of local people there who are voluntarily working and organizing. Still, I just tell them a month in advance that my dates will be for different villages. I go to 3 or 4 villages to hold these clinics, and those local people I still use those loudspeaker over a car
yeah?
or a vehicle to announce into the
Oh,
surrounding
wow.
villages that I will be coming on such and such date to this
Wow.
village to do
Oh,
the
okay.
diabetes clinic, and then people just gather on that day for me. So weather-wise, it's very hot there most of the time, and there are no facilities to hold those clinics. We don't have a room, even forget about air conditioning. There's not even a fan there.
Wow.
So you're just sitting there under a tin shed and 90 plus degrees, and each day I'm seeing about 150 to 175 patients.
Wow.
So
So the custom duty and everything that you say, that the procedural hurdle, I would say,
is,
like that.
yes,
Right?
yeah.
So now they already know you, right? I mean, the government people now already they know you that this is what you do.
No, they
So you
keep
still have a
changing.
problem?
Each trip I go, there will be new custom officers.
Yeah.
Each 3-4 years, their government change and rules and regulations change, and the requirement for paperwork change, right? And then the people who are helping me are also from rural area. So for somebody has to go to the city, to Guatemala city, and be going to all these offices for multiple times to get the paperwork done.
Wow.
It's very difficult for them also to be able to go in the city, find a place to live, and
Right.
be able to go to all these offices.
Yeah, no, plus you have some help over there, but those people also has to have a similar mentality to help people, right?
Yes, yes. No, they totally, I have a team of about 30-40 people in, like 10-15 people in each village, where they have been working since 2010, my first trip, and still working with me.
Oh, yeah?
And
Wow.
they are totally voluntarily working. There's no financial gain for them, no political gain for them. They just want to help their own people.
Wow.
Yeah.
Very nice, very nice. So that nurse is still there, your assistant?
She's not with me anymore. She moved to Texas, but her family is still there
Okay,
in
so
Guatemala,
they
that
still help
village
you?
I go to, and they're still very helpful. Yes.
Wow.
Yes. Yeah.
So tell us your day. How does where do you start, when do you end, what do you do, just give us a whole rundown.
In Guatemala.
Yeah, in Guatemala, of course.
Guatemala.
Here I know what you do.
So Guatemala is still, the rural areas. You wake up around 4 or 5 o'clock.
4 or 5 o'clock?
Because of the roosters.
Oh,
Right, wake you
roosters
up,
make you-
right? Yeah,
okay.
right. So you wake up. The people in villages start day very early, because when I'm seeing these patients, a lot of these patients come from mountain areas, nearby mountain areas, and some of those places have no electricity. So
Wow.
they come early in the morning, and they have to leave the clinic there or the area where I am by maybe 2 o'clock, so they can reach back to their homes before it's dark.
Okay.
So I wake up early also, and my routine, basically I go for a walk there first, and then get ready, and then there are approximately each, as I said, about 150 to 175 patients I see. So we have now a setup there. We have some nursing students and these voluntarily working people. They come in, so they will start checking their finger sticks first. They all come fasting, so we check their sugars, we check their blood pressure and weight, and obtain a little history about what medications they have been taking. So most of the people now, I go 3 times a year. So most of the patients I'm seeing are basically coming back repetition. So they have been on medication. I give them 4 or 5 months of medication each time. So most of them are on medications that I gave them.
Okay.
And my part is becoming more simple now. If I see their sugars are fasting sugars 100, 150, and they are on certain medications, I'll just continue them, right? If they're out of control, I will make adjustments into the insulin or oral medications, and then give them enough supply to last for, if possible, for 3 to 4 months till my next trip.
So do you have people who are trained to take the blood pressure, take, sugar level,
Yes, yes.
You already train them.
Yeah, I train them already.
train
and
them, right?
Also, how to teach people to take insulin injections also.
Oh yeah. Oh,
Yeah.
okay. So you don't have any local doctor helping you?
Not really. Those rural areas, they have government-run clinics in Guatemala.
Okay.
And those physicians, either they are busy there by themselves, or they don't have a lot of educational background, I think. They are still practicing whatever. I see that a lot of those people have the Guatemala government has some sort of affiliation with Cuba. So they have a lot of physicians coming from Cuba there and posted into those areas. They don't have much of these, they are supposed to give free medications to these patients, but they hardly get any supply.
Wow, interesting. Yeah, I mean, unfortunately.
Yeah.
Right, yeah. And I know that you're a vegetarian, so
Yes.
you must have a lot of problem in food over there too.
Yes,
Right?
yeah.
A lot of, like I know that I think you cook yourself or whatever.
Yes, yeah. Nowadays, means breakfast I eat whatever I can eat, some fruits and things there. But we usually finish these clinics by 2 or 3 o'clock in the afternoon. Then I come home or my hotel, take a shower, relax a little bit, and then go to local shops, buy some vegetables, and I cook myself now. So I take some spices from here with me, and then we just buy the vegetables. And I cook for each evening. I'm cooking for at least 20 to 25 people. I invite all the voluntary staff and the nurses who work with me during the day for the clinic. I invite them and for dinner, and we cook, together Indian food.
Really?
Yeah.
So you cook?
Yes. Yeah.
And they help you?
They help me. Yes. Yeah.
And you cook?
Yes.
You cook vegetable, you cook dal?
Dal, vegetables, sometimes
rice?
Chana, rice. And then we use their tortilla, wheat tortilla for the bread.
And that you cook everything, and then you guys
Everybody
all eat
enjoys
together.
Yes, yeah.
Very nice.
A big party every night.
But that also is a kind of like it's a kind work from you.
Yes, yeah. It's a fun part.
It's a fun.
Also because in the evening, everybody's together. We can spend some social time and
I know, but
know each other.
You should know exactly fluent Spanish.
Not fluently, it's hard because it's only a brief period of time that I can practice.
Exactly.
But then unless you practice. But now with cell phone technology, you have those Google translators that you can use if you are stuck into something. Yeah.
Right. So if anyone wants to, like, for example, help you with your trips, or do a donation, obviously we're going to put this Om Foundation on the bottom. You have a website and everything?
Yeah, it's called omfoundation.net.
Okay.
Is the foundation. It will give you the website, gives you the pictures of my previous trips, the fundraising events that I organize here.
Okay.
I do 2 fundraising organization, one in summertime and then one in November.
Okay.
At Mint Restaurant in Garden City.
Okay.
And if anybody wants to donate, they can go to the website and there are links to donate the money directly also.
Yeah, it's a good work. I mean, definitely people will be interested in. You see, it's like that. People like me, as I said before, that it's very difficult for me to help the way you can help.
Physically, you mean, but
so
definitely
we can help by giving donation.
Right,
That's the thing, right?
yes,
I mean,
yes.
at least we could do that. At least we
not
can do
only
that.
financial, even a moral support is a big thing.
Yeah.
A lot of my friends, they cannot go, but they provide me moral support,
Right,
and that is a big thing also.
Right.
Yeah.
Right. No, I agree. And somebody who is doing this kind of work, obviously we always encourage, that kind of, people. I mean, that's really, it's a noble work in my mind, and it's not many people do that.
Yeah.
So again, I want to congratulate you, and I want to thank you from the bottom of our heart to you continue doing this, and I think last time you told me that you have adopted one more village. So that means, like 150, 175 people per day Can you stay there for 7 days? You're talking about at least 1,000 people you see.
No,
every-
no, no. One day is gone in travel, and one day coming back is gone in travel.
Okay.
So I see patients about 4 days in my trip.
Oh, 4 days.
So
okay.
about yeah. So in 3 villages I was seeing about 450 to 500 patients. Now with the addition of this new village, I'm going to be seeing more people.
Right?
Yeah.
No, no.
It's a tiring day, means it's a constantly seeing those patients starting
know.
from 6,
Yeah.
7 o'clock in the morning until 2, 3 o'clock in the afternoon.
Yeah, no, it's
Seeing, and then like a crowd basically in the hot weather there,
hot
and,
weather. Yeah, weather
surrounded by all these people, and
Also. Yep. And
Yeah.
you said they don't have fan either.
not in those places. Yeah.
Wow.
Yeah.
And how about sleeping at night?
The hotels have air conditioning.
Okay,
but,
so that's
yeah.
at least that's
yeah,
better,
Yeah.
right?
But
Because
I
you
don't
can-
use much because whole day you are in 95 degrees, and then you don't want to go into 60 degrees and then wake up with cold in the
Oh,
morning
oh,
or lose your voice.
right. Well, very nice work, and like I said, continue doing this work, and we definitely appreciate it, and community, everybody will appreciate that work. And thank you for sharing with us today.
Thank
Really
you very
appreciate
much for giving me this opportunity, and I hope more people can join me, more physicians can join me, and expand these clinics and help those poor people. And not only in Guatemala, we can maybe expand it to another country, nearby countries. All those Central American countries, they have severe poverty and very big shortage of medical facilities and help. Their medications are expensive, so more physicians can join me. We can treat more medical conditions, not just diabetes.
Can we put your phone number on the bottom somewhere, so that people
Sure,
can call
sure.
you if
Yes,
it
yes.
is okay
It's on
with you?
website also, and
It's on a website also.
yes, but yes, definitely.
But we can also put it on.
Yes.
Right. Your phone number.
Mm-hmm.
Okay. And what's that phone number that we can put?
516-670-7450.
Okay, we'll put that phone number. And we are also going to show your footings that that we have, for your trip in Guatemala,
Mm-hmm.
right? So we are going to show this, as a part of this program.
Yeah, this video was made by my daughter, who did filming undergrad at Tisch,
Mhm.
NYU. So she went to Guatemala with me, and she made a short video, and that's very nice of her. That I can use it for my own. Yes.
No, and also I've been talking about this for a long time, but one day I would definitely like to accompany you and help you whatever I can.
It will be very nice. Yes.
Right, yeah.
And you'll be glad. I'm telling you, means it looks that it's very hard over there. The conditions are harsh, but I think it becomes an addiction. Once you're there, you forget about everything else.
Right.
And it's total peace. And the evening when I come back to my hotel, it's a totally different mindset you have, that you have done something, you have achieved something.
Yeah.
And yeah.
It's a big difference.
Yeah.
No. Thank you so much.
Thank you very much.
No, thank you for coming here today. Thank you, Sherry, for
All right.
sharing your professional experience and the charity work.
Yes, thank you
Yeah,
very much.
appreciate it. Thank you for joining us today. If you have any questions, comments, you can email me at rajmitv@gmail.com. That's again rajmitv@gmail.com. Until next time, have a great week. Thank you.